Hi everyone, my name is Peyton Russell, and this is my final literature review for Com 320. For my topic, I chose healthcare disparities in the pediatric populations. I chose this topic because pediatric populations are more likely to experience healthcare disparities because of lack of health insurance and lack of parental knowledge. And I think it's important for us to learn more about this so we can try to prevent the healthcare disparities in the pediatric population. It's also important because the pediatric population can't speak for themselves, but there are other ways that they can show us that they are suffering. Poverty in families and cultural differences are major healthcare disparities that affect the pediatric population. So the outline for this presentation, I'm going to tell you my personal interest in the topic as well as my research question and thesis statement. And then I have 3 articles that I reviewed. I have an interview with Katie Doty and then my conclusion and references. So why I chose this topic? I chose this topic because during this semester I had the opportunity to go to different schools and do health and lead screenings, and I didn't realize that school screenings were some of the only times that these children get medical attention. So I think that we need to change the stigma and make health insurance and parental knowledge better equipped so that children don't only go see medical professionals when they go to their school health screenings. So my research question was, how can we as nurses prevent healthcare disparities in the pediatric population? And there are many ways to do this, such as increase school screenings and follow-ups, and educate parents on Medicaid or financial assistance if they are unable to afford insurance. And my thesis statement is the pediatric population is more likely to experience healthcare disparities because of lack of health insurance and lack of parental knowledge. So my first article was titled Children and Health Disparities, and it stated that there are many conditions in the pediatric population that have a direct correlation with poverty and racism, and children from low-income communities and or families are of color often have higher risk of exposure to pollution, higher levels of contamination in the body, and more illness and physical or mental disabilities. They also stated that due to a lower household income and discrimination factors, communities of color are more likely to reside in areas of inadequate or unsafe housing and in neighborhoods that tend to be closer to pollution, such as factories or high traffic roads. Research shows that children from low-income communities or communities of color do experience greater body burdens of toxicants from the environment that they live in. Specifically in Omaha, a lot of the pediatric population, as well as most of the other population that live in areas of poverty, test high for lead because there was a lead plant in Omaha many years ago. So that's important for us to do healthcare screenings, especially in the schools, because that's how we can test children for lead and treat them for that. Another fact from this article is more than twice the number of Black children have elevated blood levels as lead levels as white children of the same age, and Hispanics are often more likely to have higher levels than white children. With higher levels of toxins in the blood, these children are at a higher risk of developing different diseases and disabilities than the other children. So the strengths of this article supports my thesis because it states multiple times that children are more likely to suffer from healthcare disparities. This article also focuses on the different populations and how specific groups suffer from different disparities. My second article was Child Health Disparities, What Can a Clinician Do? And this article focuses more on the healthcare side of what nurses and doctors can do in order to treat or prevent these disparities in the pediatric population, and it says clinicians play a critical role in diagnosing disparities in communities and practice, innovating new models to address social determinants of health, addressing health literacy in families, ensuring cultural competence and culture in the workplace, and advocating for issues that address the cause of the health disparities. And doctors' offices are a primary place for children to get looked at and ensure they are healthy and not suffering from any health disparities that can be fixed or educated on. In addition, the school nurse's office is also a good place for children to go because the school nurse will know the child and they'll be able to look and see if they are suffering from different disparities as well. The strengths of this article, I really liked this article because it supported my thesis in a way of looking at the nurses side of things and how we can treat children who do suffer from these. And we want to be able to treat the different disparities early on in life so that they don't affect their adult lives. My third article was titled, Are We Fulfilling Our Promise to Children Facing Health Disparities and Adverse Childhood Experiences? And this article focuses on the children's need and how the disparities are affected in their lives. And children need to be cared for not only physically or mentally, but comprehensively and holistically. And many of the disparities that children suffer from are either related to race, age, sex, sexual identity, location, socioeconomic status, or insurance status, and disability status. This article supports my thesis because it focuses on how different stressors and disparities can affect children later on in their life. For my interview, I interviewed Katie Doty, who is an MSN and RN, and she's an instructor of 340 at Nebraska Methodist College. So I asked her multiple questions. The first question was, what do you think the pediatric population is more likely to experience, why do you think the pediatric population is more likely to experience healthcare disparities? And she said, I believe the pediatric population is more likely to experience healthcare disparities because they have no control over the situation they live in or grow in. They don't have the authority to make decisions and change how they are brought up. My second question is, what is the number one healthcare disparity that the pediatric populations in Omaha experience? And she stated the number one healthcare disparity for pediatrics is the inequality of healthcare. The population that is seen for well checks, vaccinations, routine visits are the children whose families can afford insurance or their visits. There are many children who do not get followed up on a regular basis for normal checkups due to the lack of health care. This may be due to a financial situation, transportation situation, knowledge situation on the parent's part. My third question is, as a nurse, what is one way to reduce the likelihood of healthcare disparities in the pediatric population? And she stated, one way to reduce the likelihood of healthcare disparities would be to find ways to see and follow those children that aren't seen regularly. This might mean later clinic hours, home visits, providing pop-up clinics closer to where they live. My final question was, how do you think that we can improve the living in the Omaha area for the children who are living in poverty or in dangerous areas? And she stated the biggest way to improve here in Omaha, in the Omaha Metro, is educating parents at every opportunity about good preventative care, such as checkups and vaccinations, and also the importance of healthcare in children. So in conclusion, there isn't a lot of research due to the long-term effects of the health disparities that are experienced in the earlier years of life, but from the research that we have that has been done, it is proven that if you are experiencing a healthcare disparity when you are younger, you're more likely to suffer from diseases or disorders. So children need to be taken care of and get the best possible care when they're younger so we can prevent these. And these are my references. Thanks for watching.